Hi, everyone, and welcome to Community Chats. My name is Sandra Arevalo, and I'm the Director of Community Health at Montefiore Nyack Hospital. Today, we're going to be talking about cervical cancer. Why cervical cancer? Because it can be very preventable. We just need to be more educated about it and know what the steps to take in order to make sure that we are okay. For that reason, we have an expert with us today, Dr. Betty Varghese, and she works with Highland Medical in Stony Point, a new city here in Rockland County. She also, when I was reading her bio, it got my attention. Two things got my attention, Dr. Varghese, and thank you so much for being here today. One, you won a Medal of Honor for Service Award. That's very impressive. Thank you for everything that you do. And the second thing that got my attention was your cat. The name of your cat, actually, Tabasco. I love that. It's so cute. So thank
Yes.
you so much for being here. And the podium is yours.
All right. Thank you so much. I'm happy to be here and talk about cervical cancer. It's something I'm very passionate about, especially with the ways that we have come up with to prevent cervical cancer. It is very preventable. So first, we'll talk about the background, some background information about cervical cancer, then a little bit about HPV or human papillomavirus, as well as risk factors and the steps that you can take to prevent it, as well as a little bit of information about how it's diagnosed and how it's treated. So cervical cancer is when cells in the cervix, which is the part of the uterus or the womb that connects it to the vagina or the birth canal, grow out of control. Most of the time, people who have cervical cancer are asymptomatic. However, it is very common for patients to have irregular bleeding or spotting, especially spotting after sex, as well as abnormal discharge. And there are some late symptoms when we diagnose it when it's a much higher stage, including flank or pelvic pain, bowel or urinary symptoms, fistula formation, and sciatica. So a fistula is essentially an abnormal connection between two parts of the body that should not be there. Typically, when it occurs in cervical cancer, it is sometimes a connection from the bowel or rectum to the vagina or the bladder to the vagina. So that can manifest as passing stool from the vagina or having urine come out of the vagina as well. Another possible late symptom is sciatica. So all of these late symptoms are basically due to spread of the disease to the surrounding organs. So worldwide, it is the leading cause of death in women. There's over 550,000 new cases diagnosed annually with 250,000 deaths. In the US, it is the third most common GYN cancer after endometrial and then ovarian. And in the US, there are significant disparities based off race, socioeconomic status, and geographically as well. Black and Hispanic patients have the highest rates of cervical cancer, and there are significant geographic differences between states as well. And these differences are primarily due to poor access and barriers to preventative or routine care. In higher income countries, the incidence and mortality rates associated with cervical cancer have decreased in the past 30 years due to formalized screening programs. Now, HPV or human papillomavirus, this is the most common sexually transmitted infection in the US. And the majority of HPV infections are asymptomatic and resolve spontaneously. However, persistent infections can cause anogenital warts, precancers of the cervix, as well as vagina, vulva, and it can also cause cancers of the cervix, anogenital cancers, as well as head and neck cancers. There are more than 90% of cervical cancers are caused by HPV. And there are 10,800 women diagnosed yearly in the US with cervical cancer that is caused by HPV. The risk factors for cervical cancer include HPV infection, as I just mentioned, as well as becoming sexually active at a young age, smoking, having a weakened immune system, whether that's due to being on immunosuppressant therapy for an autoimmune condition or having HIV or AIDS or undergoing chemotherapy. There is also an association with having a history of a chlamydia infection, as well as having 3 or more full-term pregnancies and being younger than age 20 at the time of a first full-term pregnancy. So prevention, this is the most important thing to make sure that you don't develop cervical cancer. A pap test is done by usually either your gynecologist or your primary care doctor to screen for abnormal cells on the cervix. So the process of that typically involves using a speculum that is used to visualize the cervix, and then we can use any of 3 different tools to get a sample of those cells. So pictured here, you see the spatula, a cyto brush, and a broom. So all of those instruments can be used to get a sample of those cells on the cervix. And the PAP can be done with or without HPV co-testing. And the other significant way to prevent cervical cancer and HPV is through the HPV vaccine, Gardasil 9. So this protects you from 9 different strains of HPV. And I'll talk a little bit more about that in a couple of slides. So in terms of prevention, we have found that having regular screening as well as HPV vaccination has been very, very effective in decreasing rates of cervical cancer. And Australia is on track to eliminate cervical cancer by 2035, which I think is just amazing. There were no new cases of cervical cancer diagnosed in women under 25 in the year 2021 in Australia, due to how effective their national HPV vaccination program and their effective HPV-based screening. And another preventative measure that you can take is to stop smoking if you smoke, because nicotine and tobacco use can cause HPV to be persistent, and it can also aid in causing that HPV to turn into cancer or precancer. So in terms of the screening guidelines, under age 21, it is not needed. However, between ages 21 to 29, you can do a PAP alone every 3 years. So that's just the cells on the cervix. And then you can also consider HPV testing alone from age 25 to 29, but a PAP is the preferred way. And then ages 30 to 65, there's 3 different options. You can have a PAP with HPV co-testing every 5 years, a PAP alone every 3 years, or HPV test alone every 5 years. Then over the age of 65, screening is not needed if you have no history of abnormal PAPs and either 3 negative PAPs in a row, 2 negative HPV tests in a row, or 2 negative co-tests in a row within the past 10 years. So the HPV vaccine is one of the most wonderful things that modern medicine has come up with because it is the only vaccine that can really prevent any type of cancer. So it can protect you from 9 different strains of HPV that can cause cervical cancer, vulvar, vaginal, head and neck, and anal cancers. It also covers a couple of strains of HPV that can cause genital warts as well. It is currently approved for people between the ages of 9 and 45. So previously, it was only approved through age 21, but in recent years, they expanded that time to age 45. But ideally, you should complete the full series prior to becoming sexually active. So the younger you are when you start, the more likely it is to be able to protect you from developing any HPV infection or anything that can lead to cervical cancer. But again, it's a vaccine. It is not treatment for any strain of HPV or any kind of HPV-related cancer or genital warts. But depending on the age of starting the series, it is either given as 2 doses if you start before age 15 or 3 doses if starting after the age of 15. So for the diagnosis and treatment, diagnosing cervical cancer is typically done by picking up precancerous changes through a PAP. So that helps us be able to remove those precancerous cells before they turn into cancer. So that can be done through a couple of different ways. So if a PAP is abnormal, typically we will recommend that a patient get a procedure called colposcopy, which is where we look at the cervix with a special microscope and a light, and then use a vinegar solution or sometimes an iodine solution to see anything that's abnormal more clearly. And then that helps us direct our biopsies towards those areas. And then that is what we need to confirm a diagnosis of either cervical cancer or a cervical precancer. So if we find that a biopsy confirms a high-grade cervical precancer, then a procedure called either a LEAP or a cold knife cone biopsy may be recommended to remove those abnormal cells. So for treatment of cervical cancer, it is either usually radiation or surgery, but it's usually not both. So surgery can include a cold knife cone biopsy, which removes either precancerous or cancerous parts of the cervix, as well as a hysterectomy, which is removal of the entire uterus and cervix. And then if the cervical cancer is caught later on, or it progresses to metastatic disease, meaning disease that spreads to other organs, then chemotherapy is usually used for treatment. That's everything.
Well, thank you so much, Dr. Verghese, for this comprehensive presentation. And now we're going to follow up with our question and answer session. If you who are attending live have any questions or comments, please start sending them in the Q&A or the comments using the comments icon. Dr. Verghese, to start our conversation, can you tell us a little bit more about HPV in men?
So there is no routine screening that is done to test for HPV in men, unfortunately. So most of the time, the HPV that's picked up in men is usually through some type of tissue biopsy. So specifically with like head and neck cancers, if somebody has some type of like oral lesion that winds up being a head and neck cancer or oropharyngeal cancer, throat cancer, things like that, then the diagnosis is usually based off of the tissue that is sent to pathology, and then they can see that there is HPV present.
Mm. And is there a vaccine for men as well in order to prevent HPV?
Yes, there is. So the Gardasil vaccine is available to both men and women and children between the ages of 9 and 45.
Okay. Now, going back to the age factor, I saw in your recommendations, I think for women it's also until 45, right? So if you're older than 45, can you still get the vaccine or is not recommended?
So typically, it's not recommended because we typically assume that if you have HPV, then you probably got it sometime before then. And however, if you are interested in getting the HPV vaccine after age 45, it is definitely a discussion to have with your doctor. Sometimes the issue can be whether or not insurance is willing to cover it, since it is only currently approved up till age 45.
Mm-hmm. Does the HPV or cervical cancer have any relationship with the BRCA gene, or is there genetic testing for this?
So most cervical cancer is not genetic. So most cervical cancer, over 90%, is caused by HPV. So it is not related to the BRCA gene or any other genes.
Mm-hmm. If you are HPV positive, should men get screened?
So unless there is any type of lesion or genital warts or anything that are found on a male person, then there really is no screening that is available in men commercially. There's no FDA approved way to screen for HPV in men.
Mm-hmm. And I guess if you as a woman are HPV positive, should your partner get tested?
So there's no routine testing that is FDA approved for men for
Okay.
HPV.
Okay. How do you approach parents who are anti-vax or very hesitant without seeming like you're scaring or guilting them into getting the vaccine for their kids? Or even
Yeah, that's a good question. That's why I didn't go into pediatrics. But I tell everyone about the risks and the benefits. Typically, there are very minimal risks associated with the Gardasil vaccine. The only contraindication for that vaccine is being allergic to yeast because it is created using yeast. But most people are able to get the Gardasil vaccine between that age range, of course. But again, this is one of the only vaccines that's available to prevent a disease that can turn into cancer. So I tell them that that is a definite benefit. And personally, if I was able to give my child a vaccine to prevent them from developing cancer, that is definitely something I would want to do.
Yeah. Okay. And then you were talking and I was paying attention and I forgot my next question. Always happens. But it had to do with the side effects. So you say that it's minimum side effects.
Yeah. So most of the time, people have a very sore arm. It is definitely a more painful vaccine than others. I hear that complaint very often. But the most common things that have been found are typically like in usually younger boys between the ages of like 9 and 18 when they get that vaccine. They can experience like syncopal episodes or like passing out after the vaccine. But that is usually a very short-term side effect.
Mm-hmm. How do you know, for example, towards for older women, you're past 45, you're not going to be able to get the vaccine, things of that nature, and then you can get into premenopause, and then you start having these bleedings and things like that. Is there any way to distinguish between, the symptoms of HPV or cervical cancer and premenopause?
So the early symptoms that people typically experience in early stage cervical cancer is very often post-coital bleeding or bleeding after sex. That is definitely a significant symptom to be on the lookout for, as well as persistent abnormal discharge, usually with like a foul odor. And that can definitely be some of the things to watch out for as you're approaching perimenopause and menopause to look out for. But again, if you have any irregular bleeding of any sort, you should definitely see a gynecologist and be evaluated because the only way to diagnose cervical cancer is through the appropriate screening.
Mm-hmm. Can you tell us about a little bit about the treatment for cervical cancer?
Yes. So I spoke a little bit about this before. The two primary ways that cervical cancer can be treated are usually either radiation or surgery. Typically, we don't do both together. If there is evidence that there is more spread of the disease, typically radiation with chemo is usually what is recommended. But if it is early stage disease that is confined to the cervix, then surgery is definitely usually the preferred option.
Mm-hmm. Now, for the HPV vaccine, and I think this is our last question, do you need to be going to an OBGYN to get the vaccine? Can you get it at your primary care doctor as well? How can you get it?
You can get it in a variety of different places, including your primary care doctor's office, if you have children, your pediatrician's office, as well as a lot of commercial pharmacies, including places like Walgreens, CVS. They typically on their websites have whether or not they have the HPV vaccine available at your particular location. And the Department of Health is also a great place to get the Gardasil vaccine as well.
Okay, well, thank you so much. Very, very comprehensive, everything that you told us. And I don't know if you have any last words that you want to tell people, encouraging them to get the vaccine.
I think the HPV vaccine is probably one of the best things that modern medicine has come up with. And even if you have tested positive for HPV in the past, or you currently have an HPV infection, you should still get or consider getting the Gardasil vaccine because there are still 8 other strains that it covers that it can protect you from.
Okay, well, thank you so much. And thank you to our attendees for joining us today and for your questions and for your comments. Oh, we have one more. Can you still test positive after you got the vaccine?
Yes. So the Gardasil vaccine does not treat cervical cancer. Not cervical cancer. Well, yes, that, but also it does not treat HPV. And there are other strains of HPV that are not covered by the Gardasil vaccine because that only covers 9 strains, but those are the strains that are the most common. There are over 150 different types of HPV that exist. So definitely.
How many?
150.
Oh, wow. Okay.
Yep.
And this covers for 9, but they are the most
Yes.
common. Please remember that. They're the
Yep.
most common. Okay. Well, thank you so much, Dr. Verghese, and I hope to see you soon again in community chats. Thank you to all of our attendees. Have a great day, but before you go, remember, next month, we're going to have many different topics. Next week, we're going to be talking about stress management. Then we're going to have a speaker on Alzheimer's for February 12th. We're going to be talking about how to choose the best medical provider for you. And of course, it's heart disease. So we all obviously have to have something about heart disease and how to take care of your heart. So I hope you join us next week and the full month of February, and I will see you soon. Take care, everyone.